controversial, but it's important to think about. So here's an example from Christian Gabler of viral reservoirs found in the gut after COVID-19. We know that there's a lot of sort of gut problems in acute COVID and in long COVID. This is from an MGH pediatric gastroenterologist, Alicio Fasano, who found gut reservoirs even in asymptomatic kids. And the MISC was found in kids, even in ones that didn't have a particularly severe case, sometimes even asymptomatic. Again, important to keep in mind that it doesn't follow as a one-to-one ratio of severe equals long-term. Sometimes it's not like that. And he also found gut reservoirs post-viral. We hear the word post a lot, post-viral illness. There's an assumption embedded in the word post that I think we ought to just be careful of. So post-Ebola, post-Zika that I talked about before were classic examples, right? Well, it turns out that even after you did blood tests for Ebola over and over again in people having long-term symptoms, it doesn't necessarily float around in the blood. That's a bad, dumb place for pathogens to float around. They're vulnerable there. They like to get into tissues and hide out, maybe make an uneasy truce with the immune system. When we find RNA floating around in blood, I think we got to think carefully about where that's coming from. RNA is degraded pretty rapidly in most cell types. So here's an example of an MD who found Ebola virus in his eye. Remember I talked about ocular problems in long Ebola? They found a viable virus in his eye years later. And he said, at the time, Crozier thought the problems were, quote, an immune-related Ebola complication, which I have to just editorialize for a moment. I think a lot of MDs are trained that the immune system is somehow humanity's greatest enemy. And I think we ought to be skeptical of that. There's probably a reason if the immune system is acting up, there's probably a reason, maybe not all cases, but I bet most of the time there's a reason. So if we see inflammation, inflammation isn't necessarily the problem. It's the smoke where there's sometimes fire. So here's an example of Zika, again, found in semen shedding in symptomatic men. And then some macaque studies showing that even after apparent clearance, so they tested blood so to sort of prove a point. And despite not finding it in blood, it was found all over tissues after sacrifice. So again, it doesn't make sense for pathogen to just float around in blood. It makes the problem hard. It's hard to test for pathogens. Type 2 errors are just a problem. And it's maddening because people can become convinced that they're infected, even when they may not be, but it's very hard to rule out depression. Here's sort of a famous case study that you guys probably already know of viral evolution in an immunosuppressed patient. And here's testing found that SARS-CoV-2 was found in monocytes, macrophages, and endothelial at the blood-air barrier, blood testis barrier, and filtration barriers. And again, this is quite likely testing negative by nasal swab. So this is a study. It's a preprint again. It's a little bit controversial. They found spike protein in monocytes long after infection. I'm waiting to see how this one does in peer review. I think it's interesting. Some people argue that the spike protein sheds. I would like to see evidence that it's not attached to live virus. I think that's an interesting question. And here's a case study in which part of long COVID for a small number of men was erectile dysfunction. They were getting surgery to try and treat that. And some tissue was removed and they found viable virus in penile tissue. And that was what was driving, apparently what was driving the erectile dysfunction in these folks, where again, that was part of their long COVID. It's not going to be part of everybody's long COVID, obviously. So just a little bit of, let's just have some caution with the word post. But I would like to start to think of the immune system responding inefficiently rather than too much, because most successful pathogens sabotage the host immune response in some way, right? It makes sense that they would do that. So HIV is an obvious example, a dramatic example of sabotaging the immune system, but most successful pathogens do that at some level. So there's a reason that looking into type 1 interferons to fight SARS-CoV-2 has been sort of a potentially fruitful avenue, at least in vitro, because part of what SARS-CoV-2 does is to itself sabotage that type 1 interferon response. So the idea is that perhaps in an intervention, we could try to compensate for what SARS-CoV-2 is undermining in the host response. Interferons, of course, are a type of pro-inflammatory cytokine. They don't directly fight viruses, but they are transcription factors that trigger multiple viral, especially viral, fighting properties of the immune system. And so it's a smart thing for a pathogen to sabotage that. Here they point out 10 different protein products of this virus that either inhibit the induction in the first place of interferon type 1 or interfere with its signaling. And it just so happens that this is part of what keeps other pathogens in latency. So for example, 90%, more than 90% of human beings have multiple herpes strains in their body. Most of us are keeping them in latency most of the time, largely through an interferon 1 response. So the SARS-CoV-2 comes in acutely and for its own selfish reasons sabotages that interferon 1 signaling. But other pathogens are going to take advantage of that and change their virulence factors and perhaps sort of emerge from latency or from a non-replicating form. So here's an example of long COVID finding Epstein-Barr reactivation. Again, a majority of people have some of these herpes viruses. So we found that about a third of long COVID subjects versus 10% of control subjects were positive for EBV reactivation based on positive titers in IgG. So, this could be part of what, I don't want to overstate it. We don't know this, but this could be part of what is driving long-term symptoms. When these viruses reactivate, they move. That's part of their life cycle, is they move from the soma out to the terminals of nerve cells. They're neurotropic. Epstein-Barr, for example, acts as a transcription factor. Viruses don't eat or poop, right? So they have to take control of the host machinery. So Epstein-Barr has been known, for example, in a study out of Cincinnati Children's, to act as a transcription factor on the risk gene site for several chronic illnesses like rheumatoid arthritis, lupus, right? So it actually hijacks the genetic machinery at those sites. And so this may be part of why some forms of chronic illness emerge from this type of acute infection.